These are some of the questions. We got this question on Monday from someone who wants to know, why are pronouns so hard for our kids?
That's a really old question. Great question. Pronoun reversal is something that has been an issue for kids with autism for a long time. In other words, they can't use my and your appropriately and so on. And actually, we have a very interesting way of teaching that. But you know, nobody really knows why it's such a difficult concept, but I would imagine that it has something to do with the lack of perspective taking that our kids have, sort of the lack of the theory of mind deficit that our kids have, so which essentially means that our children have a hard time understanding that other people are separate from themselves. Yeah. And if that's the case, of course, it would make sense that it's would be hard for you to understand the concepts of my or your, me, you, and so on. So, but it is actually something very easy to teach, and what we do is we pair the individual's name with the pronoun and then gradually fade out the name so the child learns it. And it is one of the earlier programs that we teach, so it's very easy to fix.
Infinitely teachable.
Oh, absolutely.
Okay, good to know, because sometimes it seems so frustrating, and for a parent, sometimes you're working with your child and it seems like they're never going to get it, but infinitely teachable with really qualified people doing ABA.
Right.
Okay, wonderful. Good to know. We have another question that came in this morning. How do you teach a child the dangers of cars and streets and looking? In this particular case, they say that the child is emerging verbal and knows what cars and streets are, but has no common sense when it comes to street danger. And I want to just preface your answer to this with the fact that while we're here to provide information and for you to be able to talk to people about the kinds of things you know, we, of course, would never want to disrespect a child and make it seem that we could, or that you could in any way know specifics, child-specific things to do. So we're going to talk in terms of generalities that are really helpful.
Absolutely,
but
right.
I know that was one of the things that we talked about before, that being very mindful of the fact that we're not going to disrespect a child by assuming that you guys could write us 2 lines and that we'll know exactly what's happening.
That's right.
But you can tell us a lot about teaching safety, right?
Sure, absolutely. And you know, every child is different, and it's really important to recognize that, because depending on the child's understanding of other concepts, it would influence how you work with a child, let's say, for safety, for instance. But yeah, safety is a big issue, of course, and there are a number of different programs that we do to teach safety. I mean, one of them obviously is crossing the street or being aware of that issue. There's other safety things such as strangers or hazardous materials in the house, those types of things, and they all have to be taught. And really, behaviorally, the concept behind teaching it is that the reason that we avoid, like when you're born as a child, you actually have no fear. You don't know what is dangerous or not. You would easily, and there's many studies going all the way back to early psychology, and one of the first experiments in this area was a researcher named Watson actually did these studies where they showed that, you know, an infant would have absolutely no fear of, let's say, a snake, because, or fire, or something like that, because they have not yet experienced the resulting pain or negative consequence that comes with those things. And the way that they would develop the fear, which is really the reason that we are safe or avoid those dangerous things, is because we already have the experience, or we know that these things are dangerous, so we avoid them, we're fearful of them. So the way to teach that is really to associate a fearful type of experience with the object. So in other words, the early experiments, what they would do is they would make a loud noise behind the infant, like clapping very loud, and pair that with some object that they wanted the infant to fear. And that's classical conditioning. When two things happen at the same time, we tend to take on, one takes on the properties of the other. And so, whereas an infant might have started out not being afraid of, let's say, snakes, when it was paired with a startling noise, and you could then remove the noise gradually, and then the snake became fearful, or fear-producing itself. So, with crossing the street, for example, which is one of the safety programs, you do something similar to that. I mean, you essentially will, of course, try to get the child, depending again on the understanding level of the child, to understand sort of what could happen if a car hits a person and all of that. But in many cases, our children haven't yet developed the reasoning to kind of understand the consequence that could potentially come from this.
Right, it's that whole cause and effect thing. That's a very high function, a high executive functioning skill.
Absolutely, and it's an advanced skill.
Right. So in the meantime, what do you do because your child's a danger?
Right, and you have to realize, how do typically developing kids actually learn these types of things? And the way that they learn this is that, every time we're about to cross the street, mom or dad grabs my hand, and they are so in tune, typically developing kids are so in tune with mom or dad's, let's say, reaction to the situation or their caution, that they take on mom or dad's fear or caution about the situation, and they start to realize, like, child might go near the stove and mom or dad will say, don't go near the fire, and that reaction they take in, and they realize, whoa, this is something I need to stay away from. And with our kids, it's sometimes harder because they're not that in tuned or just aware of other people's reactions or feelings or warnings. So really, it's just a matter of kind of exaggerating the feeling, so that if the way that we do it essentially is we practice it with the child, and of course we'll give them the rules. Look right, look left, so that they know what to do in that circumstance. But we also just, in terms of safety, want to make sure that the child doesn't run into the street.
Right.
So we actually will have a therapist whose reaction is fear-based, like, oh no, don't go, or something like that. And then the child will start to develop that fear of, okay, I really shouldn't step off the curb until I'm sure that I've looked both ways and there's no cars coming. So it's really just a matter of exaggerating the normal process where kids learn, and that's how you develop fear.
That's fascinating, because I just got that. I just got that sort of missing thing that my son didn't pick up on my reaction. That's sort of that missing link there. And if we exaggerate it, then we can make sure that they're progressing with this.
I mean, we even do this with in multiple steps, let's say with identifying strangers. That's another issue, of course. And like, we will have either therapists that the child doesn't know, or therapists disguised in some way. We would set this up with the parent, go to a shop like Target or something, and try to abduct the child. And the child has already been taught to recognize certain key statements that are things that they should fear and avoid. And so, like, it's a matter of just practicing it and exaggerating what life does normally.
Yes. You guys, the Center for Autism and Related Disorders treated my child, and you guys did this with my child in a Walmart while I was practically on some sort of sedative someplace else. Dad was on the side, and there were 3 people, but Dad walked away. There were 3 people watching who made sure that everything went right, and the disguised therapist approached him, and he passed.
Awesome.
He passed.
He came over to Dad, or
he said, "You're not my dad." He walked away, yelled for help, went and got an employee, and it was wonderful. I about had to be resuscitated, but it was good to know that he would pass in a situation when we weren't there.
Oh, absolutely.
And there were a bunch of things that we did before that so that he could practice the skill. So, and then he passed. So absolutely an amazing.
And I should add, because I'm thinking about these programs are very complicated, and as I said, we're talking about them very generally right now. But it's very important when you're doing lessons that involve evoking fear, that you are certain that the level of fear that you're evoking is not so severe that you're producing a phobia now.
Right.
So you want to make sure that when the child, let's say, was crossing the street, for example, when the child has recognized sort of what is okay and what is not okay, that they don't become so fearful that they really just never want to cross the street. So it's sort of a balancing act, and it is very important to do it professionally and with therapists who know what they're doing, because as I said, our kids do actually develop phobias,
yes.
and then that becomes another problem.
Okay, so doing this responsibly and with somebody who understands what they're doing. That's fascinating. I think I've got another question. We've got a bunch of questions here, but I think we should take a little bit of a break, show you this message, and we'll be right back with Dr. Doreen Granpeesheh. Don't go away. Welcome back to Ask Dr. Doreen. We're here with Dr. Doreen Granpeesheh, the founder and the CEO of the Center for Autism and Related Disorders, and so thrilled to have you here asking questions. We've got a bunch of questions that are coming in. I'm going to put one up on the screen that's come in through our live site. Can you give an overview of ABA and AVB programs? I'm going to admit that I don't even know what an AVB program is.
Verbal behavior.
Oh, okay.
Okay, so ABA, Applied Behavior Analysis, that's, it's going to be hard for me to answer that one quickly, but I will.
Okay, you take your time.
Applied behavior analysis is basically the application of behavioral intervention. And what that means is so let's step back for a minute.
Okay.
All of ABA depends on operant conditioning theory. Operant conditioning theory is basically a part of one of the psychological concepts developed by A.B.F. Skinner. And essentially what it says is that behavior is altered by the things that happen before it and after it. That's all it is. And so an example of that would be that, a child does something good and is rewarded, and from that point forward, they know that if I do this, the child knows if I do this, I'm going to be rewarded. So the behavior of whatever it is they're doing increases because they want to receive that reward or punishment, in which case the behavior will go down. You can also change antecedents, which means things that precede the behavior, and that will influence the behavior as well. For instance, there's a million examples of that. We just don't pay attention to these things. For instance, my alarm clock rings, and that's an antecedent for me to wake up. So behavior is controlled by the things that happen before it and after it. Now, the concept of ABA, or applied behavior analysis, is that you take that principle and we've now developed that principle into very fine, detailed techniques. Because what we're trying to do when you apply behavior analysis to the field of autism, what we're trying to do is we're trying to look at our children, and in contrast to, let's say, the typically developing child, our children will have certain behaviors that are not enough. For instance, they'll have a deficit in language. That would be considered a series of behaviors, right? I mean, speaking and communicating, conversing, etc. They have deficits in play skills. They have deficits in social skills. Those behaviors we want to manipulate and increase. And then there's a series of behaviors that our kids show that are a little bit excessive, like they will tantrum instead of communicating, or they're aggressive, or they have various self-stimulatory types of behaviors that distract them from the world. And those behaviors we want to decrease. And so you have a set of behaviors you want to increase, a set of behaviors you want to decrease, and you apply these principles of behavior analysis to those behaviors, and you work on increasing these by rewarding them, and you work on decreasing these by taking away rewards when they occur and replacing them with behaviors that you are more adaptive. So that's the kind of overall concept of ABA. Now, Over the years, of course, different more detailed techniques have developed. For instance, discrete trial training, DTT. And discrete trial training is a form of ABA where you sit with the child and you will give an instruction, and which would be the antecedent.
Right.
And the child is prompted to respond, or the child will respond. And then if the response is correct, you will reward it. If the response is not correct, you will not reward it. And you do this, you know, DTT has its own kind of rules. So like you do this the first time without prompting the child, second trial without prompting the child, and typically on the third trial you want to make sure the child is successful in his response, so you will prompt or model for the child so that he receives a positive response consequence. Now, that's a really quick way of defining what discrete trial training is.
Right.
DTT, or discrete trial training, is a form of ABA. It follows the guidelines of ABA. There are many of these types of things, like errorless is a form of ABA. Pivotal response, these are all forms of ABA because they all depend on the same original concept of we change behavior by manipulating antecedents and consequences. Okay. Now, verbal behavior is, and people often confuse this and think verbal behavior is not a part of ABA, but verbal behavior was just Skinner's process as he developed, you know, so the concept of ABA. He realized that he also wrote books on this topic and said, okay, language in itself is a very interesting behavior. And we have to look at language and divide it into types. And once we've divided into types, then we can teach it using the principles of ABA. And he, you know, if you look at normal development, Shannon, which is very interesting that verbal behavior sort of follows that. When you look at normal development, the first thing a child does or an infant does will most likely be imitation, right? So they will they'll look at you and the parent might say, ba, 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 and the baby might echo that. So one of the forms of language is what's called an echoic, which really is, you know, you hear something and you repeat it. The next developmental thing that happens is what's called manding, and manding is requesting. If you know, now the baby's at an age where they want juice or something, and they'll say that ba, 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 ba might now turn into bottle or something like that. So the same expression will now turn into what's a request or a mand. That's a different form. The third stage of development, let's say the child's now 2 or 3, they're sitting in a car seat, you're driving, and they'll see something outside and they'll point to it, or they'll just say, Papa. So that's labeling. That's called tacts. Beyond that, let's say you will get to a point with the child where now the type of language usage is more abstract, a little bit more conversational. It doesn't really depend on a visual cue. And let's say you're asking the child, you know, what color is the sky? And they'll say blue or whatever it is. So that's called an intraverbal. And so these are segments of language, and the response could all be the same thing. For instance, it could be, I could be asking for something blue and say blue, so, or I could be labeling something blue, so that was, you know, a mand or a tact, and I could say blue, or I could just be discussing something that's not present and say the sky is blue. So the response which we're manipulating it could be the same response, blue. But we need to teach it, or we need to reinforce it or consecrate it with a positive in different ways. So we have to make sure the child learns how to echo it, how to request it, how to label it, how to converse about it. And unless we do all of these different, let's say, typographies of the behavior, different forms of the behavior, the child might learn blue, but not really understand that they use that in, let's say, you know, in an intraverbal conversation or in a tact. They won't really get it. That's what verbal behavior is. Verbal behavior is it's sort of the breakdown of language teaching and how you should be teaching vocal responses or behaviors. That's really all it is. So When you do an ABA program, you could be following a verbal behavior process, for instance, and making sure that you're hitting all of the appropriate mand responses, the tacts, and in that order, because they each kind of they help each other progress as well. So the most common mistake that people make, and I hear, is, oh, I'm doing a verbal behavior program, I'm not doing an ABA program. A verbal behavior program is just, it's not even really a form of ABA, it's a breakdown within just the concept of language teaching. And it is a part of ABA. So, and we here, even on our skills program, as you know, the technology that we have online, when you teach various skills, then what you can do is you can go back and transfer one of the graphs to a full verbal behavior format, so then you can actually see, oh, yes, okay, my child has is missing, let's say, pronouns, prepositions, or colors, or whatever it is, but you could transfer that graph, and then all of a sudden it turns into, oh, my child's missing mands and tacts and intraverbals and so on. So it's the same, it's sort of a parallel process. It's not something that's different in any way.
And I just want to say that, as a parent, I hear all this, and sometimes it can seem overwhelming, but the truth of the matter is that you can teach all these things step by step by step, and that's exactly what happened with my child in our home. These things were taught. My child was nonverbal, and my child's very verbal now, because these things were taught to him in a very systematic way. So it excites me now. I remember early on I would be overwhelmed by all those terms and think, how are we ever going to teach all these things? How is he ever going to learn these things and get caught up? But you guys are so good at doing what you're doing, and it is so systematic in terms of what needs to be taught, and then it can be customized to the individual child.
Absolutely.
And that's exciting.
And there's so much science behind each of these things, why do we teach manding so early on? Because it really, this is one of the things that the child is automatically motivated to do. There is motivation in asking for something, and so there's a lot of research and science and many, many years of development behind why we teach things this way.
And absolutely. And the one thing that I would ask you to also talk about is the fact that ABA was not designed for autism.
Right.
But it just happens to be very effective for autism. And we know that scientifically.
Oh, absolutely. ABA is a very old concept. In the old days, actually, when I was in the field, when I started in the field, it wasn't even, the label ABA didn't exist. Really? It was called behavior modification. And it gradually just sort of morphed into a ABA. And really, behavior modification, or ABA, has been used across many different domains. One of the very common uses of ABA is in the employment setting, in the organizations where they will use various techniques of ABA to increase employee efficiency, increase, even any workplace. If you really think about it, when we want to improve the morale of our staff, what are we doing? We will have little events, and we will give them gift cards, and so that's we're saying, hey, we want to reward your behavior. It's all ABA. And if you really think about it, Shannon, everything we do is set on those principles. Yes. It really is. And so it has now, of course, been applied to autism, and one of the earliest examples of applying it to autism came from the work of Lovas.
Yes.
And when we took ABA principles and applied them to autism, it showed the world, oh, okay, if you use these techniques and you do them in a very meticulous fashion, and you do it in a very sort of discreet, well thought out, organized process, then children with autism are able to focus on that. They're able to actually change their behavior and improve and get much, much better and learn just like any other child.
And no one would believe it to look at you, because you look far too young, but you were a part of that original Lovas study.
Oh yeah, I've been doing work with kids with autism since 1978.
That's amazing.
Yeah,
well, I hate to tell on you because no one would know that to look at
Thank you.
So. But this whole thing of being able to increase behaviors we want to see more of and decrease behaviors we want to see less of, it's a miracle.
Right.
I call it the autism miracle in my living room. So, which on that note, we should take a little bit of a break. We've got a lot of questions coming in, and there's no way that we'll get to all of them, but we will answer more questions after these messages. Stick with us. Welcome back. We are here with our new segment, Ask Dr. Doreen. Dr. Doreen Granpeesheh is with us. We have a question here that I'm going to put up on the screen. I thank you guys so much for writing in with your questions. We're going to get to as many of them as we can. I just want to pose a question, and I understand you're having a little bit of trouble with a Flash player. There is a thing to download if you're having trouble, but at what point do therapists stop over-prompting children with functional language? Are they taught anything about processing time and giving a child at least 2 attempts to answer before prompting language? I'm showing that to you on your screen right now at home.
That's an amazing question. Like, if that was asked by a parent, that parent knows their stuff pretty well.
We have some savvy parents who watch this show.
Oh my gosh, yeah,
That's great.
absolutely.
Okay, so at what point do they stop over-prompting children with functional language? We'll start there.
Right. So, and then the question actually goes on and says, do they know to not prompt until the 3rd trial? Which is kind of an interesting question from a parent, because that's what I just described, which is sort of the discrete trial model, which is amazing. So, you know, now that I described the discrete trial model, there's, you know, I should talk about the errorless model, for instance, which is another aspect of teaching. And the errorless model says we just don't want the child to make any errors. So let's prompt a lot and start with prompting a lot and then gradually reduce our prompts. Whereas the discrete trial model goes the other direction. It says sort of give the child a chance without prompts, without help. And if he's making mistakes, then correct him. You know, so that's sort of, or prompt him on the 3rd trial. So, you know, just if you really think about it, when you are teaching a brand new concept, right, the child's not going to really respond correctly. Right. So why waste time and allow the child to make a mistake on the 1st trial or 2nd trial? Why not just prompt? And because what you're doing by prompting is modeling for the child so that he can see what the correct response is, and then gradually fade your prompting so he's responding on his own. So what we do here a lot of times is we will start out with an errorless model. This is that card. And so because we really want our kids to have a positive experience with ABA, and we want them to actually have the best use of their time. So we will prompt the child, and start fading the prompts, and then eventually get to a point where, okay, the child's getting these concepts now, so I can actually move into more of a discrete trial model where I don't have to prompt anymore, and then overall I'm not prompting at all after a while. When you ask the question, when do therapists realize that they should stop prompting, or why are they over prompting, that's really something that should be discussed with the supervisor of the program, because while you really want to make sure that the child is successful, so that's why you prompt, at the same time you don't want to over prompt, because the child will, our kids are very smart. They will figure out that if they hold off, if they wait, they'll eventually get prompted. Right. So then they become kind of prompt dependent. And that becomes a very difficult thing to get rid of. So that is something that if the parent feels there's over prompting going on, supervisor should look at the situation. And this is not going to be across all areas. Like, so when we work with a child, we're working on multiple different lessons. And the supervisor would then identify what lessons are being over-prompted, what areas, and maybe we should really step back a little bit in terms of prompting and allow the child to respond on their own. So, you know, that's really something that is quite important and can be evaluated by the supervisor. Here's what I'm coming to understand about ABA, that it is a creative art, that there are all these tools, and our children are all individual, and we're going to apply these tools in a creative way for each lesson, and that it's really case by case, and oh my gosh, because your child might fly through one lesson but need a lot of support with another lesson, and different children are going to respond in a different way. So there's no be all end all. Oh, absolutely. Answer. I mean, there's no like cookbook approach to this. Like, you know, you might have a child that what you said, very important. When children are developing language skills, like just vocalization, a lot of my kids, like they'll have a strength in what's called matching programs. So they're sorting or matching visual things to each other. That's easy for them. It's strong, and so they will not require that much prompting because they know they can get through it fast and they learn it fast and it's visual. But when it comes to verbal types of programs, they have a very hard time, and they're like will require more prompting because this is a more difficult program for them. Another aspect of prompting is like the child is different. If it's let's say a 2-year-old, their attention span might not be as much as a 4-year-old, or the other way around. If it's a 4-year-old that has a lot of self-stimulatory types of behaviors, is distracted easily, which then again goes back to their sensory abilities. You know, like let's say it's a child who's overly sensitive to noises and sounds, they're going to be distracted by everything. And so that type of child will not only need more prompting, but they'll need more reinforcement to stay focused for the same amount of time that another child wouldn't really need that level of prompting and reinforcement just because they're not distracted.
Right.
All of these types of things come into play when, so you know, a good therapist really just gets to know the child and understands what his issues are, what makes it easy for him, what makes it hard, when will he, like a lot of times for me, when I know that I'm starting a difficult program for one of my kids, I'll start to really prompt a lot, reinforce a lot, and make the sessions shorter because I want the child to be successful.
Absolutely.
So these are things you really have to evaluate.
So it really is by the minute. And it brings up a question that we had the other day that I want to get to. Somebody wrote in and said the acoustics of the lunchroom and the gymnasium where their child is having recess and lunch are a sensory nightmare for my child, is what they said. What can I do to help him be able to be productive during recess and lunch? And they wanted to know specifically, we had a big discussion the other day about, are there IEP goals that we can write in to help our child to be more productive during lunch and recess? So it's kind of a twofold question. So maybe the sensory one first, that very echoey sort of space that can be so overwhelming for our kids.
Yes, absolutely. But it is something that's teachable. But the question really becomes, you know, you can with your school, for instance, you can have a certain number of accommodations made for the child, but really, realistically, they're not going to accommodate a single child by changing the entire acoustics of a big lunchroom, right? So there's nothing really you can do. There are certain things that you can change in your environment in order to help the child, but you know, the bottom line is there are certain things you can't change, and B, there are certain things you want your child to adapt to anyway. This seems like one of those scenarios where you can't really change the acoustic system or, you know, sound level or whatever it is in the lunchroom or even outside, because I mean a lot of our kids have problems with recess because because of the noise, you know, the background noise and so on. So you're going to have to teach the child to adapt to that. Yes, you can do that. Absolutely. It's a series of steps. I'll give some examples. So, for instance, you know, 2 ways that you control it, honestly. One is, first of all, you want to give the child right off the bat other options during that time frame, and depending on what's, you know, socially appropriate in the and what level your child is, because we never really want to do modifications that would stigmatize our children in school. But regardless, let's say the child is really disturbed by the sounds at recess. Is it possible for the child to perhaps have a period of time during recess where they have some headphones on? Is it possible for the child to go to portions of the playground that are less noisy, perhaps those types of things? Because the immediate solution, I mean, not solution, but the immediate step would be to make the child more comfortable.
Right.
As you're doing that, then you want to make sure you're actually teaching the child to adapt to this. So one of the things we do, for instance, is we will actually start to tape record some of the sounds that are bothering the child, and we'll start to put those in the background at home. So, for instance, a lot of my kids are able to focus very well when it's in a quiet room, but as soon as we introduce any kind of background noise in the room, then they're distracted the whole time. They can't really focus. So you start with it's a shaping procedure. You start with a very low volume on the background noise, and you gradually bring it to a point where you see, okay, this is my threshold. This is like, as soon as I take it above this volume, it's distracting the child. And then you practice easy lessons, things that are easy for the child at that threshold level, and then you start to increase the threshold to the point where, and then you continue to practice the child staying focused and doing the things they're supposed to do as that background noise becomes more intrusive.
Wow.
And, you know, background noise, of course, could be anything. I mean, you could literally tape the conversations in the lunchroom or in the playground noises, whatever it is. And eventually, as you do this, then you get to the point where, like, let's say you will actually practice the behavior in the actual lunchroom where the acoustics are intense. And at that point, the child will have more success because now they've actually learned how to process the background noise. This is a very important thing. A lot of our kids tell me that, you know, later in years, they tell me that the sound of language was more of a background noise for me, and typical background noises like doors opening and closing were what the child heard in the foreground. It was like more of a prevalent sound for the child, and so it was very hard for the children to focus on language, you know. And I always give this example when I'm doing conferences. You know, when right now, for instance, you and I are communicating and talking, and if I was to, there's a lot of background noise, we just don't hear it. There's the air conditioning, there's various things that are in the background, and if you switch your mind, which is called set shifting cognitively, and you focus on that, then you can hear it.
Right.
But we're so in tune and so habituated to listening to language that we don't hear it. And our kids don't have that ability. They don't have the ability to filter out the background noise, and it just is hard for them. So it is a shaping procedure. It can be done. You expose the child to low levels of the distracting noise, and you gradually increase it to the normal level.
That's awesome.
Yeah.
I love that. And then for the other part of it, in terms of, there was a big discussion earlier this week about IEP goals for recess and lunch, and and the myriads of things that we could suggest depending on where the child is. Is there anything that you'd like to address in terms of those?
We have a million different IEP goals that we set up for recess, for lunch, for all different, periods of time at school in between the classes. In order to make those goals actually happen, and in any IEP, you have to write who's responsible for this. So, of course, it's easier for us because a lot of times we will have a therapist or a shadow in the school so that we can actually work on those types of goals. And but if you do have an IEP and you don't necessarily have your own staff in there, then you're going to be asking the school to provide an aid during lunch, during recess, in order to make these things happen. What are some typical goals? Oh my gosh, there's a million of them. Anything from, being able to sit at a table and have lunch with other children without grabbing their food, or giving your food away, or whatever it is, appropriate lunch behavior. If it's a higher functioning child, then we're talking about appropriate communication and conversation during lunch. Recess, yes, of course, there's a million,
play goals and
every aspect of recess. I mean, how does a child identify what they want to do during recess, because there's 10 things happening. How do they approach a group of children to ask whether they can get involved? Do they know the games and types of activities that are going on? I mean, we want our children to engage and be able to do what all other children are doing. So you have to take those skills, teach them individually at home where the child is focused and is able to practice, and then you take them into the school setting and you just sort of generalize them there and implement them.
Wonderful. We've got so many questions here, and so I apologize that we're not going to be able to get to as many of them as we want, and there was one in particular that I wanted to get to that somebody wanted to know, their question is, what influence has technology had on our kids, our kids with autism in the area of perseveration? She says, I assume it's a mom. Could be a dad. I wish that I could eliminate all rewind buttons on all my electronics because there seems to be no end to how many times my son will repeat favorite scripts from favorite shows or favorite sounds from favorite songs. It drives me nuts, and the nuts is in capital letters with 2 exclamation points. What do we know about technology and perseveration, and what can this mom, is there anything we can be talking about to help ourselves when our kids perseverate with things like that?
Sure. And technology is good and bad. Yeah. I mean, if you look at our own lives, right? I mean, now everybody has an iPhone or whatever, and you think to yourself, how did I even survive without this before, right? So to some extent, we're all perseverating on technology right now. But having said that, technology is also very interesting for our children. I don't know that anybody's really looked at why, but there are a lot of children who will learn more from a computer than they will from a person. Perhaps that has to do with the fact that it's easier to focus on a screen than it is on someone's eyes, for our kids at least. Perhaps it's more controllable when they focus on a screen. So I have both feelings about technology with our kids, because one of the things we're doing, Shannon, is that we are actually developing games and resources for our kids online, so that if they get on the computer, for instance, then they're actually doing activities that will be educational and helpful to them. And the games are different from games that are out there, because our games are really based on those principles of ABA that I was talking about. So it gives the child prompts, it gives them rewards, it gives them a certain number of times to make errors, all that sort of stuff. So it's embedded in the game.
It's cool.
Now, they're awesome. Cool. They're terrific, because I mean, if you think about it, if our kids could actually learn a lot of these things on their own, great. Why not? Now, having said that, one of the things that this parent wrote is the child repeatedly, I know hundreds of kids, they will repeat a section on a video or DVD over and over and over. Okay, so let's put away the actual what it is they're perseverating on, because it could be video, it could be technology, it could be anything, right? I mean, I have children who are perseverating on the wheels of a truck, or children who are perseverating on water, playing with sand, whatever it is, they're perseverating on it. And this takes us back to asking, why is the child perseverating on this thing? And there's some aspect of obsessive compulsive behavior, or OCD, obsessive compulsive disorder, which is common with autism, because that involves when we have obsessive behaviors, compulsions occur, and compulsions are really perseveration. You perseverate on something. Why do we do that? The reason is because we're trying to gain some form of control over our environment and reduce our own anxiety. And that's the reason, I think, that a lot of our kids develop these sort of perseverative behaviors, routines, rigid, formats of things have to be a certain way. They're trying to maintain some sort of control over their environment. And I could talk about that for hours, because I feel like our kids really don't have a lot of control over what happens to them. So the short answer to this is, any behavior, whether it's technology or anything else, that's perseverative in nature, it has a positive component, which is it makes the child feel a little bit more calm, a little bit less anxious, a little bit more safe. But it has a very strong negative component, which is the child is so engaged in this perseveration that they're not focusing on anything else, and they're not learning from anything else. Okay, so limit the perseveration. In other words, what would you, and I always tell this to parents, if your child was a typically developing child, what would you say is an appropriate amount of time to be on the computer? Let's say an hour a day, and then limit your child to that same amount. And the rest of the time, either you're going to have to block the child from going towards the computer or video or whatever it is, or you're just going to have to remove it.
Right.
And don't worry if the child loses it and gets very upset and angry and so on, because remember, this is something they were sort of depending on to calm themselves. But make sure that you are offering the child another activity that is also calming, that's perhaps more adaptive, more appropriate. Could be anything, as long as there's someone watching over them. It doesn't really matter. But don't take it away completely because you're concerned about the perseveration of it.
Okay.
Limit it to what would be normal. In fact, if you take it away completely, you'll never really be dealing with the perseveration issue because it's just not present. Then the next time the child goes to someone else's house, they'll perseverate. Next time they have access, they'll perseverate. So you have to deal with it. Yeah. And the way that you deal with it is you just limit it. Now, if it's a child who's repeating, just hitting the repeat button, you have to stand there and block it. The child should be allowed to watch it for a certain period of time without repeating it. And that's that. Or if they really want to repeat it, perhaps you can use it as a motivation and have the child request for you and say, can I see it one more time? And then if they say that, you'll show it to them. And you won't do it 10 times. You'll just do it 2 times perhaps, or 3 times. Just think about what is the typical behavior that you would like this to turn into, and then you shape the child towards that.
Which is very common sense. I don't know that I would have thought of it that way, but it's very common sense approach to it.
Right.
Wonderful. I think we probably have time for one more question before we have to let you go. Okay, there's so many questions to choose from, but I want to ask a question for somebody who has an older child. This question is, I'm going to put it up here for everybody. Push this one. Hi, I'm a mom of a soon-to-be 20-year-old and an advocate for children and families. The wave of children with autism is getting closer and closer to transition age, and no one seems to be adequately preparing for them. What should parents and agencies be doing together, particularly for kids on a more functional track, to assist in preparing them for life in the adult world? It's a frightening thing for all of us.
Yes.
The idea of transition.
Absolutely.
And the sheer amount. I mean, there's so many kids now, but then as the number grows, the sheer amount of kids in the next few years who are going to be transitioning to adulthood.
That's right.
And how do we get prepared?
That's right. And, historically, the focus of ABA has always been on younger children, just because the applications in the early days were with younger children. But the truth is, there's many more research articles and publications showing the positive effects of ABA with adolescents and adults. So we really need to develop more opportunities for our adolescents and adults. Now, we have at CARD what we call CARD 2 program, which is for our adolescents and adults, but it's a very different program than the sort of early program, because it's not what we consider a comprehensive or intensive early intervention program. So it's more a focused program. Nevertheless, it goes through multiple stages, and I'll just briefly talk about that. When you're dealing with an adolescent, again, this becomes really critical. It's like we have adolescents or adults that are not even able to communicate yet, and they have developed severe behaviors as a result of not being able to communicate. And so on the one hand, and on the other level, we have very high functioning adults or adolescents who are actually quite functional, and perhaps they're just experiencing some depression, some anxiety from a lack of social skills. I mean, so there's a huge, broad spectrum when you start looking at our adolescents and adults. Now, what we've realized that you basically have to go through a series of things, and you start with always challenging behaviors, because if there are challenging behaviors, everything else is kind of you can't deal with other stuff, right? So you really just need to first deal with challenging behaviors, and if the individual is able to express themselves, typically these challenging behaviors go down quite significantly, because now they have a functional use use of language, and they can use language instead of, tantruming or hitting and so on. So you take care of the challenging behaviors, and then you start going up to, let's say, functional communication. And functional communication is just sort of getting their needs met, being able to communicate what their needs are and so on. And you progress from there, and you will, at the highest level, we're teaching our kids things they need for college or vocational skills.
Right.
A lot of our kids, it's very interesting actually, because we forget that our adolescents and adults are adolescents and adults. They're adolescents. They're just like anybody else. They also they have habits that have become ingrained. They will get upset and angry when they're bored. I mean, there's certain things, and we see, like, when you teach the adolescent a vocational skill that they really love, like some of my kids like carpentry or whatever it is, you know, they stop having those challenging behaviors because, wow, now they feel really good about themselves. They're producing something. They're part of a job. They're active. They have motivation and goals and all of that sort of stuff. So it really is critical that agencies start to develop more programs for our adolescents and adults. The transition period can be easy if you are able to help the adolescent or adult just get into the things they're interested in. It's the same principles, use better communication instead of challenging behavior, start to actually acclimate to their environment, pay better attention. If we can take these programs and develop them more for our adolescents, then the transition period is nothing. It's actually quite easy. But I really feel for this parent, because the whole society, we are so unprepared for this, and there is just really, if you think that it's hard to get into a young ABA program, oh my gosh, for adults and adolescents, it's almost impossible. I mean, there's very few programs that are actually even focusing on these individuals, and whereas if you do, the effects are phenomenal. So.
Well, I'd like to remind everybody, though, that you have been working with that population for a long time, and that they can go to centerforautism.com, click on the locations tab, see if there's an office near you. And I also want to touch briefly on the fact that there are some amazing lessons and skills that are for, I know a lot of people tend to think that the skills program, which is the online curriculum that you have developed over 20 years, and there are some amazing things in there that aren't just for little kids, that I personally am a huge fan of the executive functions curriculum. And when I read through it myself, it changed how I looked at a lot of different things. I think it's a great program for any teenager, on the spectrum, not on the spectrum, anywhere in the world, to prepare them to be successful in life. And especially for our kids that are, and that high functioning population that she's talking about. I think that executive functions curriculum and the cognition curriculum and the social skills curriculum
totally applies,
are amazing.
I mean, and the programs and skills go up to a mental age, a chronological and mental age of 8, right? But when you talk about that, like with typically developing kids, their actual age and their mental age is the same, which is why our IQ is 100, right? It's the mental age and chronological are the same. Now with our kids, their chronological age is getting higher and higher, and their mental age doesn't always develop at the same rate. So you could have a 15-year-old who really is not performing the tasks that a 6-year-old would be, or is at that mental age. So skills is very appropriate for our adolescents, and really it's just about making those two, the mental age, come closer to the chronological. There's a lot of things in there. There's, and I don't want to ignore the very, very higher functioning Asperger's kids who are older and so on, because their issues are completely different. They have a lot of issues around depression, anxiety, and so on, because they start to see themselves as not fitting in, just like any other child.
It's a hard time.
And all of that sort of stuff can be supported as well with ABA. You can really start to teach the kids how to feel better about themselves, how to see things in their environment as a little bit, more accurately, and not necessarily think that the world is making fun of them or that they just don't fit in. And so, but I mean, all of these things are possible, but it's harder just because so many agencies don't work with the adult population.
Absolutely. Well, we hope that that will change and that more people will pay attention to the kinds of things that you've been doing for years with that population.
I hope so.
We're essentially out of time here, but I want to stop for just a second and thank you for being here.
Oh,
and thank you
pleasure.
for your work that you have been doing in this field. You truly are a visionary, and we look forward to you being here every week. For those of you who wrote in questions that we didn't get to, we'll keep them in a pool of questions, and we'll look forward to more questions. Several people wrote in the same kinds of questions, so we'll weed that out. But we want you to know that we hear you and that Dr. Doreen Granpeesheh will be back with us next Wednesday and for the foreseeable future,
I love it,
every Wednesday. I'm so excited to have you here.
Thank you. I enjoy this a lot. This is what I wish I was doing all the time. So,
well,
thank you.